Hi, I'm Jessie. I'm a doctor of physical therapy and certified frequency specific microcurrent practitioner. And this is a video that is going to answer a question that I get often from my patients in the clinic. And that is, what is the difference between FSM or frequency specific microcurrent and PEMF, Pulsed Electromagnetic Field Therapy? It's nice to know the difference between the two, and there is also an important distinction between what most PEMF is out in the world and what we call frequency specific PEMF, which utilizes dual channel, so that means there's two different frequencies running at the same time, frequencies through the PEMF delivery system, which makes it very similar to frequency specific microcurrent. Microcurrent is delivered via electrical pulses through a little device that is battery operated, hooks up to either sticky pads, electrodes, or towels, and it produces microamperage electrical pulses that run through the body in order to deliver this two-channel specific frequencies. So let's back up just a little bit. When we're talking about two-channel specific frequencies, it is as taught by Carolyn McMakin, the founder of Frequency Specific Microcurrent, who certified me in FSM. And it is operating under the understanding that each tissue in the body has an optimal resonant frequency that we describe in hertz, Hertz, or pulses per second. And each condition that we are working to neutralize or improve or change also has its own optimal resonant frequency, also measured in hertz. So my job as a clinician is to do an assessment, a physical examination. It can be with objective questionnaires. It can be just by interviewing you and understanding your history and what you've got going on. It can also be from your lab resulting and any other testing or measuring that has happened. We can also do what I call a frequency response test in the clinic, where we are noticing the subtle shifts and changes in your tissues to the frequencies that we're using. So it's my job to gather all that data and then customize ways to put these two frequencies together that will help your specific situation. So at Resonant Frequency Medicine, I specialize in this level of customization. A lot of practitioners will assess you and then go to a list of pre-programmed protocols and go, what on this list best matches what's in front of me? And that's a fine way to practice, but we're taking it just another step further and customizing more in depth based off of what you show up on the table or to the clinic that day with. So I'm dialing in specific frequencies for your condition on a unit like this, which allows me to make changes in real time while it's connected to your body on the table. So we've got, for example, reduce inflammation as a condition frequency in the spinal cord as a target tissue, and we're combining those two together to elicit really positive changes. We can also change the delivery system. So it's still dual channel, but instead of the frequency specific microcurrent delivery system, this is a magnetic converter delivering frequency specific pulsed electromagnetic field therapy. So another version of frequency specific PEMF looks like this, and I often prescribe home units in this form because it is so simple and easy to use and has fantastic outcomes. So something like this would simply wrap over the shoulder or tuck into the belt or wrap around the knee and so on. You can even put this in your purse and walk around the grocery store running a protocol. And that's part of why I absolutely love this system of delivering the frequency-specific pulse electromagnetic field therapy. So the difference between frequency-specific PEMF and standard run-of-the-mill PEMF is that we are working with 2 or more channels at once, which enables us to really specify the treatment. Any protocol I've ever written on the FSM microcurrent devices can be applied to PEMF, transferred into a pulsed electromagnetic field. A lot of PEMF systems out there are great. There's evidence that they work and are helpful, and they're typically single channel devices, meaning they're working with one frequency instead of 2 frequencies. So it's kind of like same delivery system between these 2 PEMF devices, but they're talking a slightly different language. It's like German versus English, for example. In some cases, they do transfer over really easily, and we use some of these single channel frequencies on the devices that I use. But in some of these standard pulsed electromagnetic field devices, there are typically limitations on the level of customization that you can work with in these devices. So a lot of these have 5 or 10 preset protocols that you can run through that are great and helpful and effective, but that's all you can do with them. And with the devices that I use, they are infinitely customizable. And so that's why I love using this form of frequency specific PEMF, because I have total control over being able to dial in specific frequencies and customize them to my clients on the table, and the understanding of the relationship between the dual channel frequencies. We're not just running one frequency, we are running stacked frequencies so that we can have more specific outcomes. And then one thing I want to mention, the difference between frequency specific microcurrent and frequency specific pulsed electromagnetic field therapy is microcurrent donates more electrons to the system that it's treating. So there is a slight increase in energy that's available at the cellular level when we use microcurrent. The benefit of using pulsed electromagnetic field therapy is that that system requires far less cumbersome wires. I can write protocols that last overnight and allow people to run protocols for a longer time without being stuck to the cumbersome wires. The outcomes of surgeries that I've supported with microcurrent versus PEMF are almost identical. Some individuals I do prefer to use microcurrent with if they really need the bolster of energy, the electron donation. However, the vast majority of my patients do just fine with PEMF. And because it is so portable and easy, and I can send protocols remotely to my patients, that tends to be the home unit setup that I send people home with. So I hope this helps to clarify the difference between FSM, PEMF, and frequency specific PEMF. If you have more questions, please put them in the comments below, and I will do my best to create another video that really dives as deeply in as we need to on this topic. Thanks for your time, and thanks for listening. Take care. See you soon.